चुप कर जा। This is a case of duodenal ulcer. Actually, this patient had already undergone sclerotherapy and hemoclipping for a large duodenal ulcer in anterior duodenal wall. The classification was Forest 2A. Patient had a visible vessel for which hemoclip was applied and had undergone sclerotherapy a day before. But again, the patient had massive hematemesis, and also a rent was seen even in the previous endoscopy, which was suggestive of partial or healed off perforation. So we had planned this case for ovesco clipping. So this is the diagnostic upper J which we are doing. So this is where the culprit lesion is. We have applied the cap beforehand to see demarcation where we have to apply the ovesco brand. We are just trying to wash away all the clot which is seen above the ulcer. So my assistant is giving repeated washes. You can also use water jet in these difficult cases. So I'm also applying a little bit of suction so as to remove that clot, because even after repeated washes it is difficult to remove that clot. So I'm applying a little bit of suction also to remove that clot. So we have this clot we have caught, and we are trying to dislodge this clot from the front of the scope. So majority of the ulcer has been washed. We are still giving washes. Actually, duodenal ulcers at the anterior abdominal wall are very difficult to treat because gastroduodenal artery passes just beyond this area. So these ulcers tend to rebleed. Still trying to remove this big clot which is over this ulcer. So if you can see at the left lower end, you can see a little bit of rent in the anterior abdominal wall, anterior duodenal wall, which is suggestive of a partial tear or a sealed off perforation. So as soon as we have removed the clot, we could see the area from where the blood was oozing. We could also see the partial rent. You can see while I'm washing, the blood is coming again and again, and if when my technician is giving the wash, the blood is coming again and again, and you can see the rent. In the anterior duodenal wall. This is the area from which the blood is coming, and just below it is the area from where the rent could be seen. So we are now inspecting whole of the lesion to see where is the best site to deploy the ovesco clip.